Hey, Dr. Brad Murray, coming at you from the Golf Lab. Today, we're going to talk a little bit about your foot, how to get it to move a bit better. Is your foot flat? Do you overpronate? Drop navicular? All these things are very similar causes where that arch of your foot is down more often than it should be, and it's causing a lot of biomechanical stress all the way up through to your low back. What we're going to do today is we're going to show you how to work on keeping that arch up where it's supposed to be and getting a lot more of that intrinsic foot control that's going to help you push your game forward. So if we look down at the feet here, you're going to see pretty easily that arches can be nice and high or they can be low. They can be high or they can be low. You're going to notice that as that arch is high, those knees are open and the hips are externally rotated. This is a very powerful position. This position, with everything collapsed in, knock-kneed, is a very unstable, poor position, and often we don't get into this position. We actually have our feet apart and we externally rotate and will collapse that arch. Also a very poor, bad position that puts a lot of stress on the knee, the hips, the ankles, just a real poor position. What we're going to work on today is rolling that arch up, keeping it up, balancing on one foot, really struggling to keep that arch up, keep the weight on the heel, roll it forward to the toes, keep the arch high, roll it back to the heels, and going to go back and forth with that guy. Once you've done this guy a little bit, you may notice some cramping in your foot. That's perfectly normal the first few times that you do it. That's those intrinsic muscles that haven't been working well enough for you, starting to wake up from their slumber. This is good. You'll notice that it'll go away. A little bit of foot rubbing will help get rid of that too. Give it a try. Help get those arches up. Get rid of those flat feet. Stop pronating. Be powerful.